Well, allergic reactions can range from moderate to severe, but all of them can affect the quality of your life.
Yeah, joining us now is Dr. Erik Alexander with the Dermatology Associates of Wisconsin to talk about a great way to determine what you're allergic to. It's called patch testing, and today we're specifically talking about skin allergies, right?
That's correct. So patch testing in dermatology is a very powerful tool that we have to determine when a rash may be due to an allergy. It's important to understand there are different types of allergies. So a lot of people have been to an allergist and have had prick testing done where they will poke you with specific allergens and see if a spot immediately welts up. That's great for foods and pollen, cats, dogs, that type of thing. But that's not a common cause of chronic skin rashes. So we're doing a different type of testing, looking at a completely different set of allergens.
Okay, so who should be tested? When you're looking at the kind of person that should try this sort of skin patch testing, who is it that should come in and do it?
And it's a very individualized decision, and it requires evaluation, careful consideration. But in general, the types of rashes we're looking at are often long-lasting chronic eczema-type rashes, so dry, red, itchy, irritated skin. There are often some clues, rashes that are localized to a particular body area, those that frequently come and go, or things that seem sort of situational or aren't responding to treatment.
Mm-hmm. Where, if someone gets a rash, where does it most likely show up, or does it depend on what they're allergic to?
It absolutely depends on the allergy. You're completely right. So depending on which body area it's in, it sort of raises different suspicions for what might be causing it. Obviously, we use lots of different products on our face than we do on our hands. Things in the clothing area may be related to dyes. It really is very situational.
And let's talk specifically, as you patch test, what kinds of things do you find? So if someone has a rash on their, just run through a few examples, on their stomach, on their legs, on their face, that kind of thing.
So we test for a lot of different chemicals. A very frequent kind of battery of tests that we use are 80 of the most common allergens. A lot of these are preservatives, fragrances, metals, rubber products, a whole bunch of different things that come into contact with our skin on a regular basis. Some of the more common ones we see are things like nickel, which, as you said, could definitely be waistline, can be jewelry, things like topical antibiotics, and the list really goes on, and that's why we have to cast such a wide net.
Okay. So when you're coming in to have an appointment, what would you expect during that appointment? What would happen when you see someone like yourself?
So it's a bit of a labor-intensive process, not too bad, but that's the reason why we want to sort of individualize this. It's usually a series of 3 appointments. So we'll see someone initially, and we'll make the decision to patch test, and we'll apply these patches. They go on the back. Each one is approximately the size of a deck of playing cards.
So it's truly a patch.
Exactly. And each of these patches holds 10 different allergens. So your back will be taped up often with 8 of these, as I said, for that standard battery of 80. We'll keep those on for 48 hours, see you back, and remove them, and get an initial idea of what's going on allergy-wise. But then we frequently follow up about a week later to really get the complete picture and try to put everything together and figure out what role allergies may be playing in the rash.
And as far as the results go, then of course, obviously you can avoid certain things. If you know you have an allergy, then you can avoid it. What else do the results help you do in terms of making a recommendation to a patient?
And that's a great point, and avoidance is key. Most sort of eczema-type rashes come from the inside. They're sort of a disorder of the immune system. Those we can't cure. We're just trying to control them. Allergies, similarly, we can't cure, but if you can avoid it, it's as good as a cure. So we give you a list of everything that you've tested positive to, and then it just becomes a matter of becoming a compulsive label reader. And any new product that you're going to use, it's important to check all the ingredients and see if there are any that cross-match with your list of allergies.
I can imagine even for kids, when they're having rashes like that, you just don't know what's causing it. I mean, this can bring such peace of mind and help that child throughout so much time, moving forward.
Yeah, absolutely. And we see surprising things all the time, sometimes even sort of comedy of errors almost that no one could have predicted, and that's the power of the patch testing. I'm reminded of a recent patient who had a rash, and she tried to put on some antibiotic ointment, got worse, saw her doctor, was given a couple different anti-inflammatory creams, kept getting worse. We patch tested her and found that she happened to be allergic to all 3 of those things that she had used. So no one would have known, but we were able to get her something that gave her relief. relief, and she went from having skin peeling off of her hands, unable to work for several weeks, back to normal and no rash.
Well, and I think it's a vital piece of information to have, because generally if you have a strong reaction to something, it's a lifelong allergy. So if you kind of are aware of it, keep a little card as you recommend with you what that ingredient is or what that is specifically, you can avoid it and avoid a lot of problems. And just to remind people, in terms of who should be patch tested, it's a great list that you offer. It's someone who has frequent rashes, someone who has recurrent rashes, or someone who has atopic eczema with frequent flare-ups, something that doesn't go away, something that keeps coming back, or that third category.
Exactly, yeah, and things that aren't responding appropriately to treatment. So, yeah, that's when we decide to look, and it's surprising sometimes what we find.
Yeah.
All right, well, you can contact Dr. Alexander if you'd like to get a patch test done at 1-855-DERM-WIS, or visit them online at dermwisconsin.com as well. Again, it's called patch testing. So that's how you can learn more about it.
And you have a number of locations throughout the state, so people can visit one that's close to them and find out which one is the closest.
Absolutely, many convenient locations, so it should work out well for people.
Thanks, you so much.
Thank you.
Great job.